All right, so here is my presentation for the paper that I'm going to be writing, the professional manuscript paper. The title that I have proposed is Exercise as a Prescription for Better Breast Cancer Outcomes. The reason why I chose this title is because the research that I'm looking at is just how um, the side effects of breast cancer can be, kind of eliminated or bettered due to exercise. And so just the outcome being in general better for these patients. The journal in which I found which takes submissions would be the Journal of Clinical Oncology. And then in terms of presenting at a conference, there were different conferences kind of closer than Thailand is, but many of them, the dates are to be determined. So this is really the one with a solid date. It's the Second World Conference on Breast Cancer and Cancer Research, November 21st to 22nd in Thailand. So it is a little bit far away. There are other conferences which would be considered probably stronger than this one. It's just they're unsure of when they're hosting the conference. So this is the one for now. These are not all the citations, but some citations um, in terms of like systematic reviews and reviews for the paper would include the impact of exercise interventions on physical fitness and breast cancer patients and survivors, which is a systematic review, which just assesses um, the impact of interventions in which people have prescribed exercise for these patients, and just reviewed, physical fitness. The study did highlight the importance of tailoring exercise interventions to breast cancer care, which is important to tailor those exercise programs to your patients. So that's a great systematic review. One of the other ones I just highlighted here is the effects of exercise interventions during different treatments in breast cancer. So something that this research article found is that exercise during breast cancer treatment improves strength, cardiovascular function, and quality of life. So the study did highlight the need for further research on optimal exercise modalities for patients, which is important because I think that the papers that I found, which are going to be going along um, with these citations, focus on like those different modes of exercise. So I think that that is a good, you know, research, like a further research question that I'll be talking about. Um, I just put in here, like, while the Journal of Clinical Oncology has published several articles examining the impact of exercise interventions on breast cancer patients and survivors, um, the topic that I'm looking at is how these different types of exercise relieve symptoms from like chemotherapy, from radiation, from the ways that these patients are being treated. And so it just kind of furthers the research, like we're talking about, goes along with what's already there. It just helps validate everything that's already there. The subheadings that I'm proposing is talking about like the supporting research, the role of exercise in breast cancer management, exercise interventions, and the impact there, and then challenges, recommendations, and future directions for these patients. So going into like a little bit of more into that. The supporting research would include the systematic reviews, meta-analysis, um, mechanisms of action, long-term benefits, guidelines from like clinical organizations. I think is all important to talk about in terms of supporting research. Um, the next subheading, which is just the role of exercise in breast cancer management, um, talking about how treatments like chemotherapy, radiation, and surgery often lead to these different symptoms like fatigue, muscle loss, reduced quality of life. Um, Talking about how regular physical fitness and activities have been shown to improve things like cardiovascular health, muscle strength, and just like an overall well-being, improving that quality of life in these patients, and in survivors. Hoping hoping to help them, feel like they survived the cancer and didn't just like live through it, if that makes sense. Um, and then just the fact that exercise can help mitigate treatment side effects, like as I just talked about, lymphedema. So, water buildup and fatigue, mental health challenges like anxiety and depression, and then, yeah, how it helps shape their quality of life when they are focusing on working out. The next subheading would be exercise interventions and their impact. So, the different exercise interventions that are found within my citations would be aerobic exercise, resistance training, having combined exercise programs, and then the alternative modalities like yoga, um, Pilates, flexibility, that kind of stuff. Um, but talking about how, aerobic exercise um, improves cardio fitness, reduces fatigue. Resistance training would help maintain muscle mass, bone density, and strength. These combined exercise programs, they found significant improvement in just overall quality of life, physical function. And then these alternative modalities like the yoga, flexibility, and, Pilates, stuff like that, was said to have been found to reduce stress, and then support mental health, which I think is a big factor when you're struggling through something like this. The last subheading that I proposed is challenges, recommendations, and future directions, looking at some of the barriers to exercise, which would include lack of energy, treatment side effects, accessibility to maybe exercise equipment, working out, and then just the fear of overexerting yourself as a patient. Um, Strategies for implementation. Having these personalized exercise prescriptions is important, making sure that they're supervised, and then making it accessible to your patients. So either having an online program or an at-home option for these patients, and then having like knowledge of your future direction, which just means like knowing like what the future, not like what the future holds, but what the future could look like. So um, being able to optimize exercise prescriptions for these patients so that when they're done with you, they still have something that they're working for. So having these different treatment phases, and then knowing like the role of digital interventions in promoting physical activity, just making it more accessible to more people. In terms of like tables and charts, um, just kind of doing like a summary on the studies, making columns with like study, sample size, type of exercise, key finding type stuff. You could also do a timeline of exercise benefits during like breast cancer treatment and recovery time. So like having the treatment phases and then having improvements being recorded on those different treatment phase times. Some practical implications in terms of like charts would just be like recommendations for patients. So, like lining up for them, like treatment stage, exercise type, intensity, and then filling those columns out. I also liked the idea of like telling them the impact of exercise on quality of life scores. So just like showing pre and post scores of people who went through these exercise programs, just showing how they feel like their quality of life improved. In terms of pictures, website links, and additional resources, I think it could be cool to include some diagrams, some timelines, some flowcharts, um, maybe like a timeline showing them like when it's important to incorporate these different exercises, um, and then like a diagram like it says here, illustrations of what they're going to be doing. So aerobic exercise, resistance exercise, and flexibility exercises, um, just getting them familiarized with the motions that their bodies are going to be doing. I did list some website links for the American Cancer Society, different clinical trial, and then the ACSM exercise guidelines for cancer survivors, which is a great resource to have. And then in terms of like additional resources, there are lots out there, but books, podcasts, YouTube channels, and then just different cancer institutions, centers who have these programs set up for their patients. So this is my proposed plan. I'm excited to get going.